I want to get the COVID-19 vaccine, but I've got some concerns. I'm worried about how quickly they made it.
It's true that COVID-19 vaccines were developed at record-breaking speeds, but that does not mean any safety steps were skipped along the way. Here are 3 factors that contributed to the speed. Production started before the end of Phase 3 clinical trials, which were successful. There was a lot of interest in volunteering for the trials that tested the vaccine's effectiveness. Typically, researchers can wait many months, even years, to get people to volunteer for trials. There was a lot of the disease in the community, which made it faster to see whether the vaccine was effective.
But what about the side effects?
It is normal to have certain reactions after a vaccination. There might be redness or swelling around the injection. Fatigue, fever, headache, and aching limbs are also not uncommon in the first 3 days after vaccination. These normal vaccine reactions are usually mild and subside after just a few days. When it comes to serious side effects, the risk is extremely low, less than 1 in 50,000 according to Stage 3 trials. Given that an elderly person has a 20% chance of dying from the disease, the benefits seem well worth the risk.
I'm confused about all the different versions.
Every week we are hearing about a different vaccine from a different country with different statistics, but for Australia it's actually nice and clear. As a nation, we will likely be using 2 vaccines. The Pfizer vaccine. Developed in the US and Belgium, this vaccine is administered in 2 doses and has a reported efficacy of 95%. Australia has 10 million doses on order. The AstraZeneca vaccine. The benefit of this drug is it is being manufactured right here in Australia, meaning our supply is secured. 50 million doses will be developed domestically, with around 4 million additional doses imported. The reported efficacy is about 70%, and just as with the Pfizer drug, it will be administered in 2 doses.
How do I choose which one to get?
You won't have to. The 2 vaccines have been divided up and will be administered in priority-focused phases. We know the first priority and most at-risk Australians will receive the Pfizer vaccine in Phase 1A of the rollout, which will include quarantine and border workers, frontline healthcare workers, aged care and disability care workers, and residents. From there, the government plans 4 further phases of the vaccine rollout using the AstraZeneca drug to protect most of the Aussie population.
I'm worried about how much it's going to cost.
No need to worry. Vaccines will be made available to Australian citizens, permanent residents, and most visa holders for free.
I still have some more questions.
As we get closer to vaccine rollout, more information will be made available to you and more communication will come directly from the government. In the meantime, check out www.health.gov.au.